My name is Sima Atorodi. I'm planning to do my PhD in back pain at Bangor University. I'm a medical doctor from Iran and I've been in this country for 3 years. Chronic low back pain is one of the main problems of healthcare systems in the world. 80% of people experience low back pain during their life and up to 20% of them become chronic. In spite of the fast development of modern medicine, there are many people who suffer from low back pain for a long time, and it affects many aspects of their life. For example, they may have difficulty taking part in work, their family life, and with the hobbies. This results in a reduction in their quality of life.
Hello, I'm Jeremy Jones. I'm a consultant rheumatologist at Bangor in North Wales, and I've spent a lifetime trying to help people with low back pain. I have learned that in many cases this is difficult and that just treating the physical symptoms and the pain is not enough. Indeed, many studies show disability levels in back pain are more closely associated with the patient's belief about the cause of the pain and what they think about it, rather than what we find when we examine the patient or when we look at their MRIs. This means we need to look at the physical factors, the social factors and the psychological factors when we come to treat people with low back pain. A mindfulness-based approach is a psychosocial intervention which may be useful for people with low back pain.
Mindfulness is a practice of non-judgmental, purposeful moment-to-moment attention to one's own experience as it arises in the mind. In this study, we will investigate the effectiveness of the mindfulness-based interventions for people with chronic low back pain. Some previous studies have shown that this method can reduce the patient's stress and help them in the process of coping and acceptance of their pain, but there's a lack of rigorous research which would provide the evidence needed for broader use of mindfulness-based methods in this area. People in today's industrialized world are often very outwardly oriented, often overwhelmed by media and social networks, and are less aware of their body, feeling, and emotions. Mindfulness provides techniques which help people get closer to their sensations, thoughts, feelings, and to learn new ways to relate to their inner life. As research shows, these new skillful ways of working with the mind can result in improved mental and physical health. Mindfulness-based approaches are secular methods based on meditation. They are typically delivered in the form of 8 weekly sessions, 2 hours in duration, and participants are encouraged to follow guided meditation practices at home. Mindfulness-based approaches have documented benefits in a range of conditions related to stress and anxiety, most notably recurrent depression. This means that mindfulness-based techniques can be used both to improve well-being and quality of life in patients with clinical conditions and in prevention of stress and anxiety-related problems.
So when we are looking into whether a form of treatment helps a condition like back pain, we carry out a series of measurements at the start of the treatment, we then apply the treatment, and then we repeat the measurements to see if they've improved. These measurements are called outcome measures. The usual outcome measures used to test low back pain treatment are questionnaires using a standard series of questions. These outcome measures have been devised by doctors and researchers, not by people with back pain. For example, the patient might be asked whether they can walk upstairs when they live in a bungalow, or whether they can drive a car when they haven't got one. On the other hand, a pianist might find that she's unable to sit to play the piano, or a young mother might find she's unable to bathe her baby. This means that the standard outcome measures are often not relevant to the individual patient. To overcome this difficulty, a series of patient-centered outcome measurements have been devised. These measurements get the patient to identify how their back pain affects their lives and show what effect the treatment has on these activities. In this study, we are planning to see if mindfulness improves patient-centered outcome measures. As far as we know, this has not been done previously.